this sleeping disorder is one of the major disorders felt, or people come across, especially in elderly. And all have a doubt whether I am sleeping more, I am sleeping less, or is my sleep okay? I am getting up early, I am not able to sleep immediately. When I go to bed, I am not able to sleep. These are all the kinds of problems that people face, especially the elderly. And today's, the major number of people, maximum number of people attending these seminars are all elderly. Therefore, I think we are concentrating on elderly. Therefore, it is better that we know what exactly is sleep, how long a person should sleep, and how to go to sleep early, how to avoid medication for these kinds of sleeps. See, because often we get into when I don't get to sleep, I immediately go to a doctor, and I go to a pharmacy, ask the pharmacy assistant to give me some tablet, gulp it and sleep. Is it all okay? This is exactly these are all the doubts that senior citizens have today, I would request you to kindly concentrate on this. And I also make one request to our senior friends here that, please note down all your queries and put it in the chat box, so that at the end of the session, as soon as doctor finishes her presentation, we can always go back to her and raise our doubts and get it clarified. Thank you, ma'am. The floor is for you. Let me not stand between you and your audience. Thank you. God bless.
Sure. Sure, sir. Sure, sir. Thanks for the warm welcome. Just give me a moment to share my slide.
Please go ahead, ma'am. Doctor, I think you are not audible.
Are my slides visible, sir?
Slides, it was visible earlier, but
okay,
you are not audible.
Okay, just give me a minute.
Yeah.
Is it fine now?
Yeah, it is fine, ma'am. It is fine now.
Okay, sure. So let me start with my presentation. As sir told, I will be presenting on the topic sleep disorder in elderly. So about sleep, not only in elderly, in any age group, be it children or young adults or elderly individuals, sleep is a very important thing for us. So it is important for our general health and well-being. It is almost like a mini vacation that we take daily so that our system will reboot and revitalize to face the next day. So it is very important for our restorative functions and for our optimal daytime functioning. And sleep disturbances affect not only our nighttime sleep quality, but if it can be a risk factor for daytime sleepiness, which can ultimately affect our functioning during daytime. So coming on to my topic proper, I will be focusing on insomnia or sleep disturbance. What is insomnia? So insomnia is basically any dissatisfaction with your sleep quality or sleep quantity. So it can either be difficulty in initiating your sleep. That is, once you go to bed, you find it difficult to start sleeping. Or it can be difficulty in maintaining your sleep. You wake up in between and then you are finding it really hard to fall back to sleep again. Or it can be early morning awakening, like say at least 2 hours prior to your usual waking time. And any of these, when present and causing distress or impairment to your functioning, then it can be considered as a disorder. So the main thing that you have to look for is whatever duration you are sleeping or whatever change is happening with your sleep, if you are distressed by it, That is, you are feeling tired the next day, you are not able to focus your attention on your work, you are having memory disturbances, or you are in a cranky mood, getting irritable with everybody. And if your functioning is getting affected, then we have to understand that it has slightly progressed to a disorder level. And if it is present for at least 3 days per week, ranging between 1 to 3 months, that is a significant problem that you must address. So what about insomnia in elderly? So the first thing that I want to tell you is that how prevalent is insomnia in elderly individuals. So if you are having sleep disturbance or your loved one is having sleep disturbance, then it is important to recognize that you are not alone. So literature states that approximately 50% of elderly individuals, that is those above the age of 60 years, they experience insomnia in one or the other form. And women are estimated to suffer from insomnia about 1.5 times more commonly than men. And the type of insomnia that is seen in elderly individual is the difficulty in maintaining your sleep. You tend to wake up and then you don't get to sleep again easily. And then again, the type of insomnia is secondary insomnia, meaning you have some other cause, like a medical cause, an emotional cause, a physiological cause that is leading on to your sleep disturbance. So secondary, that is more common in elderly than the primary de novo sleep disturbance. So that is the one thing. So take home message is that it is fairly common. Now, another question is that I have mentioned that it is fairly common. So is it a normal thing in elderly? If you are having sleep disturbance and it is distressing for you, should you just consider it as normal and just do nothing about it? So the answer is absolutely not. So there are some sleep changes that happen with aging, like the sleep pattern changes as your age advances. You may fall asleep early and you may awaken early, or the total sleep time, that is, the total sleep time or efficiency may come down, or you may have fragmented sleep. So again, as I mentioned, if this thing has gone on to a level where you are distressed by it, then you may be developing insomnia. Otherwise, these changes are normal if it is not distressing for you. So normally, an elderly individual is expected to have anywhere between 5 to 7 hours of a sleep without any daytime dysfunction. So that is the thing that you have to look out for. Then another thing, what are the causes of insomnia? So there are a multitude of causes which are possible, like lifestyle changes, medicines you are taking, pain, brain disorders, stress, psychiatric illness, lung disorders, something known as obstructive sleep apnea, heart diseases, or the primary insomnia, which occurs just like that without any particular cause. So we will look into these things in a little bit more detail. One is the lifestyle factors. So especially I think after retirement, so the habits, even those people who had a strict routine prior to retirement may have gone into a slightly irregular sleeping habit and eating habit, like that. So irregular sleeping habits, not going to bed at a particular time or waking up, not having a proper routine for that, can lead on to insomnia. Another thing is daytime napping. So when you are sleeping during the daytime, you're expected to have decreased sleep at night. Then it will go on to become a vicious cycle, and finally, you will have trouble sleeping during both these times. Then there can be substance use like alcohol and smoking, or lack of exercise or inactivity, or excess screen time or electronic gadgets use, especially during bedtime. So when you are looking at these gadgets, you are exposing yourself to light. So it can interfere with the biological things like melatonin secretion, which is especially important for your circadian rhythm, your rhythm of day and night, and which helps you to sleep at night. So that's also not good. Then reduced social interaction is in fact found to be an important thing in people who suffer from insomnia. Then there can be environmental factors, inappropriate lighting, inappropriate temperature, or noise exposure that can interfere with your sleep, or even your partner's sleeping habits. If you are having a partner who snores excessively, then your sleep can be disrupted. Then there can be medications. So many of the, like, as we all know, as we age, we tend to have more and more of comorbidities like diabetes, hypertension, chronic obstructive pulmonary disease. So we will be on multiple medicines for that. So in that situations, there are some medicines which can interfere with your sleep. So whenever you are having sleep disturbance, it is very important that you tell your doctor the medications that you are taking. Then another thing is pain. So in elderly, we see that many of the problems are normalized and they are ignored. As in case of sleep, another thing that people commonly ignore is pain. So we'll be like, okay, elderly individual, they will be having one pain or another. They'll be having sleep difficulties. We tend to normalize like that. So chronic pain is one important contributory factor to insomnia, be it back pain or pain due to your osteoarthritis or any neuropathic pain secondary to diabetes, hypertension. All these things can interfere with your sleep. So you may not perceive that you are waking up multiple times in between your sleep because of this pain, but you will definitely feel that you are not refreshed or your sleep has not restored your functioning when you get up. So that will be there. Then there are renal and urological problems. Chronic kidney disease can interfere with your sleep, and especially in elderly men, this enlargement of prostate gland is something which can lead on to frequent urination or nighttime urination, multiple episodes. This can also interfere with your sleep. So this is like a rhythm, and all these factors are contributing to your uh, sleep disturbance. And another medical conditions, neurological conditions like many cognitive or memory disorders associated with that, you can have sleep disturbance. Parkinson's disease, again, much before the other symptoms start, you can have disturbance with your sleep. Then psychiatric disorders, especially anxiety and depression, or your stress response to your major life events, be it physical like illnesses or interfamiliar, personal, other issues can interfere with your sleep. And another thing is grief, like loss of a spouse or dear one can trigger insomnia in many individuals who are otherwise predisposed due to medical comorbidities, medication, substance use, etc. Then endocrine disorders, especially those related to thyroid, hypothyroidism, hyperthyroidism, can interfere with your sleep. Heart and lung diseases, where breathing difficulty can directly be a cause for your sleep disturbance. And gastric, like when you have gastroesophageal reflux, you will have this acid reflux occurring when you are in the lying down posture. So you may wake up multiple times and you may not even realize that. So, yes. Then another is obstructive sleep apnea. So obstructive sleep apnea is a condition which is usually seen in individuals with a profile like they are obese, they are having hypertension, thick, short neck, hypothyroidism, and those with crowded upper airway. So in those individuals, there can be sleep disturbance secondary to a condition which is known as obstructive sleep apnea, wherein you are experiencing periods where you are not able to breathe properly. Your system is not getting oxygenated properly. You are getting breathless while you are sleeping and you tend to wake up. So this keeps on repeating during the night and you are not getting a proper sleep. So in these individuals, we can identify easily in the way that there will be significant snoring. Your snoring will be audible even outside that closed door. And you will suddenly wake up gasping for breath. And in less severe forms, that gasping for breath may not be there, but still you may be waking up without realizing. And you will be tired, daytime drowsiness, dozing off. These things are features of obstructive sleep apnea. So if that is there, you have to specifically intervene for that, like managing. There are modalities like CPAP, continuous positive airway pressure, where you will wear a mask and your oxygenation will be maintained during night so that you don't wake up gasping for breath like that. If these things are not there, it can be primary insomnia also. That is, it's not secondary to any other cause. Then another two fancy things are this restless leg syndrome and periodic limb movement disorder. So restless leg syndrome is a condition in which you get a creepy crawling kind of feeling and an irresistible urge to move your legs when you are at rest or while you are trying to fall asleep. And this is usually worse at night. So you have to keep on moving your leg. So when you are trying to fall asleep, it happens, you move your leg, you wake up. So this goes on in cycles and you don't get a proper sleep. And there can be multiple causes for that, like iron and folic acid deficiency, where your urea level is high, uremia, neuropathy, and diabetes, thyroid disorder, your like lung related disorder known as chronic obstructive pulmonary disease. So many things can contribute to that. Then there is another condition known as periodic limb movement disorder, where you will kind of briefly, repetitively move your legs during sleep. And it may last only 0.5 to 5 seconds, but this kind of occurs every 20 to 40 seconds, and that in severe situations it can interfere with your sleep. This is seen to increase as a person's age advances. So if you have any sort of these problems, then also it is better that you get evaluated, because all of these problems which I mentioned, this can secondarily lead on to insomnia. And in order to treat your insomnia, we have to find out what is affecting your sleep and specifically manage that. So that is the importance of all these symptoms. Then what if your sleep disturbance is not addressed? What can happen? As mentioned, in your day-to-day life, you will experience less functioning. Functional impairment is there. In your social life, in your occupational life, it can affect you. And also there can be increased risk of depression and anxiety. It is kind of a bidirectional relationship. When you are having sleep disturbance, it can lead on to depression and anxiety. That can further lead on to sleep disturbance. So again, you will be in a loop or in a vicious cycle. Then it can increase your risk for long-standing insomnia, can increase your risk for hypertension, cardiac illness, and even stroke also. And you are at risk for increased metabolic disorders like hypertension, diabetes, dyslipidemia, even developing obesity. All those things can set in. And there are some reports that it can even lead on to it can maybe act as a trigger factor for developing some of malignancies like carcinoma of prostate. Like, that's not a conclusive report, but studies are coming up like that. So it can have wide implications that we are aware of and we are yet to know. And of course, it can lead on to cognitive disorders in a long-standing way, and it can indirectly be a burden on the healthcare system as well. So what you can do? So first thing, you have to remember what I have told you now. Like, if you are having any sort of sleep disturbance, you have to look at whether you are distressed or dysfunctional due to that. If that happens, it is a red flag sign that you have to seek help. Then if you notice that you are having this, the basic thing that you can do from your side is follow some sleep hygiene measures, about which I will talk subsequently. So those are a set of do's and don'ts, practices that you should do and you should not do so that your sleep is all right. The second thing is that you have to avoid self-medication. So like sir had mentioned a few minutes back, the first tendency will be to go to a pharmacy and get something for sleep. So that is everyone's first tendency. So that's not good, because you wouldn't know whether the medicine that have been given to you is the right one, or whether it would suit the other diseases that you have, whether it can worsen that, and whether it is of addictive potential, how long you can continue. So those things you have to be aware of, because unchecked use can result in complications, as well as many of the medications have addictive potential. So you will have to go on increasing your dose, and finally it will be double trouble. So that is avoid self-medication. And third thing is getting help. So whom should you approach? So you should approach a medical practitioner or a mental health professional. So they will be doing the basic assessment and giving you the necessary guidance. So now coming on to what sleep hygiene is. So some things that you have to strictly do as per sleep hygiene is have a regular sleep schedule. It is okay if once in a while you are going to the movies or you are attending a wedding and you are not able to sleep on a time. That's okay. You can be chill about that. But the thing is that it's better that you have for normal days, it's better you go to sleep at a particular time and wake up at a particular time. And you should ensure a good sleeping environment, that is usually dark, slightly cold, and noise free environment is preferred. But whatever is your comfort, whatever you are used to, you should have a comfortable environment like that. Then another thing is regular exercise. It is shown that physical activity will improve your sleep quality as well as quantity. But when I'm telling physical exercise, it is also better that you don't do any exercise within 6 hours of going to bed. So immediately, if you are doing any exercise, heavy exercise, it may have the counterproductive effect. You may become more alert rather than sleeping. So physical exercise is important, but not close to your bedtime. Then limit caffeinated beverages, coffee, tea. If you are having insomnia already, after 5 o'clock, 5 p.m. in the evening, try to avoid taking any caffeinated beverages or limited. And it's also advisable to unwind for an hour before bed. So we'll be having so many stresses during the day, like we would have been very busy running uh, about something. So it's always advisable that 1 hour prior to going to bed, you do something that is relaxing to you. Talk to your family members if that is not stressful, or you can read, have some light reading, listen to some light music. So do some unwinding before you are going to bed, and use bed only for sleeping. So, because if you start associating, if our brain starts associating sleep with other activities like watching TV or looking at the mobile or eating or reading, then it will be a message to our brain that this is not exactly your sleep time or the place where you are sleeping. So, we will teach our brain bad habits. So, it's better that you use bed only for sleeping. Then some don'ts are that, especially if you are having insomnia, don't fall into the trap of looking at the clock every 10 minutes. What is the time, whether I have slept or not? That does not help. That will increase your anxiety and that will worsen your sleep. So please don't do that. Another thing is heavy exercise before bed, as I mentioned. Just before bed, avoid that. Then using gadgets like mobile, computer, or watching TV in bed, that's also not advisable for the same reason I mentioned before. And even heavy dinner immediately before bed is also not good. Avoid alcohol and smoking, and also avoid daytime naps. And for elderly individuals, those who are above 60 years, half an hour nap, maybe post lunch, is permissible, but not more than that. Then, when you decide to seek professional help, I think it's better if you have an idea how professionals are going to help you. So, because most of the people have a notion that when you go and meet a doctor and you are complaining of sleep disturbance, the first response will be to write a sedative. Mostly it will be something addictive, and then you are in the trap. So it's not like that, or at least it should not be like that. So what we will do is that we will take a detailed history, your medical history, your sleep history, the details of what is happening, what type of sleep disturbance you are having, what sort of comorbidities you have. So what are the things among that which can impair your sleep? What is your environment where you sleep? So whether you are having any psychological issues, whether any anxiety, depression, we assess all of these things in detail. So we'll also do some baseline investigations. Like I told, many endocrine problems, these things can result in sleep disturbance. So we will do some basic tests. But usually, specific sleep related tests like polysomnography, all those things are not usually done. We will do those only in specific situations, like if we think that you are having obstructive sleep apnea and you are gasping during your sleep, and sometimes we may advise special test for that. Otherwise, it's just basic investigations to make sure that your systems are working properly, and also to know that which medicine we can give you to help you better with the least side effects. So that's the approach. Then treatment also, as I mentioned, most of the insomnia in elderly individual is secondary. So we'll identify the cause and treat. And we also have behavioral interventions and specific medications, pharmacological management also. So what are the behavioral and psychological therapies? So it usually helps people who have some faulty thinking process related to their sleep, too much anxious about not sleeping. Even in the presence of insomnia, if you are too much anxious that you are not sleeping, that can also affect your sleep. So psychological, those who are having faulty thinking process and some faulty behavior, we try to correct that by recruiting you to the or guiding you to the specific therapy. So sleep hygiene, as I told, is universal for whatever sleep disturbance that you are having. It is universal. Apart from that, there are other therapy modalities like stimulus control therapy, where we associate the stimulus of bed to sleeping. Only that. So we give you some instructions and we keep track of that. Like go to bed only when sleepy, get out of bed when unable to sleep, use the bed or bedroom only for sleeping, rise at the same time every morning, irrespective of the duration of sleep or quality of sleep you had, and avoid napping. So we will give you the instructions. We will guide you in following it well, so that if there are some faulty practices, we can also correct that. Then there is another modality known as sleep restriction therapy. So this is especially for individuals who spend hours lying on bed without sleeping. So here what we do is that we will, in order to improve your sleep efficiency. Sleep efficiency means how much time you are actually sleeping when you are on bed. So in order to improve your sleep efficiency, we actually start by decreasing the time you are lying on bed. And as the quality of your sleep improves, we kind of increase the duration uh, that you have to lie on bed. So different modalities depending upon what kind of sleep disturbance you have and what kind of thought process you have related to that and what kind of practices you are doing to deal with these issues. We will guide you to different therapies. So this is just for you to understand that there are different things like this. Then of course, relaxation training can help you in de-stressing and sleeping better. Sometimes you can perceive that muscle tension. You are not relaxed when you are in bed. So there are specific procedures which professionals can train you in to decrease physical tension and help you sleep. And there are cognitive therapy also. Like I told, those who are too preoccupied with the sleep disturbance and those who have this anxiety which is interfering with their sleep, there are cognitive behavioral therapy which the professionals will provide for you. Then pharmacological therapy. So as I told, we usually choose if we have to give medicine for you. Like doctors also don't prefer to give medicine as the first line thing. Like sleep disturbance, especially if you can manage without medicines, perfect. But if you are not able to manage without medicine, then definitely you have to manage with medicines because, as I mentioned, there are consequences. So sometimes we may have to opt for medications, but in that case, we will do a risk benefit analysis regarding whether medicine would help you or what sort of medicine would help you. And benzodiazepines are the category of medicines which are notorious for dependence. Like many of you may be familiar with many different medications like this alprazolam, lorazepam, clonazepam, those medications. So you are likely to develop tolerance if you use that medicine. That is, today, if you are able to sleep with 1 milligram, later on you may require 2 milligram, then 3 milligram, 4 milligram. So the medicines are like that. It can have that kind of effect on your brain. But depending upon, like I told, there are medical conditions in which it is preferred also. So based on that, we will choose it. And another multiple medications are there which are not benzodiazepines and which do not characteristically have this dependence or tolerance properties. So it's mostly we will select medicines based on a patient-tailored approach. So now summarizing my presentation, the basic thing is that if you are having insomnia, any sort of sleep disturbance, point is associated with distress, then don't normalize it. You seek help and always follow sleep hygiene measures in order to prevent as well as manage insomnia. So thank you.
Thank you, Doctor, for an excellent presentation. I think, now it's time for people, whoever wants to raise any doubt, anything, they can raise their questions. So they can unmute themselves and raise the question to the doctor so that doctor can reply your concerns. And I really thank doctor for very beautifully explaining in a very short period of time what are all the basic things that we senior citizens need to be worried or we need to take care regarding sleep. So I think with this, I now request all the whichever participant wants to raise any doubt, please raise it. Please.
Good evening, sir.
Please go ahead, sir.
This is Krishnamurthy from Bangalore.
Yes,
sir. It's really a nice talk. It is informative. As far as this speech is concerned, we try to practice it more and more. And in my case, what happened for the past 30 years, I'm hypertensive. Now I'm 67, 68 now. What happened now, the doctor initially, once he went to the hypertensive, I was not knowing they have given the tablet called Restil tablet 0.5 mg. So after some time, people said you should not take this one. This will affect the kidney or such thing. When the other people told, I tried to sleep without that thing. I could not do so because I got totally addicted for the past 30 years. But I'm not increasing the dosage. But I'm on 0.5 mg Restil only every day. but my sleeping pattern and all maintain it. But I still feel I'm not totally got the quality sleep, and it is a disturbed sleep only. I'm not become once when you get up, you become fresh, so fresh, no. But still the tiredness is hanging over. Number one. Number two, that the sleeping pattern and all, I maintain it once or twice in a night. I may have to urinate it because I take the hypertensive medicine. And this is my thing, how you can help me, because all those points we try to practice it, rather we avoid this electronic gadgets and watch read a book or something like that. But you want to say until unless you get a sleep, you should not go to bed. Am I right?
Exactly.
So
So what
this
we
particular
advise
point.
regarding that is go to bed only once you are sleepy. And if you are not getting sleep while on bed, you get up and preferably go to some other room and do something relaxing and go back when you are getting sleep again.
So what is your advice, Doctor? Because now recently, 2 years back, I had a corona attack and also subsequent heart attack also. So I'm taking the medicine for the heart medicines. But otherwise, normal every day, one kilometer up to the extent I walk.
So my advice for regarding that is that like good that you pointed it out, sir. Like sometimes I have seen patients that they are already taking some sedatives, but they are not aware about that. So maybe some random prescriptions for short term, or doctors would have meant it for short term, but somehow it had got carried over. And like sir told, this benzodiazepines or medications, you may end up taking it for years together. So the important thing is that whether you are having good sleep. If it's not there, we will do one comprehensive assessment regarding that. And if we are finding that, okay, to provide good sleep for you, we have to further increase this medicine, which is addictive, then we may think about managing it in an alternate way. Because whether we can change over this medicine to something less, which is having less side effect potential, which you can take for a long term. So that will be our approach. And like you told correctly, before that, we will inquire and see whether all the other things have been done properly. But my suggestion is that if still you feel that your sleep is not sufficient and it is affecting your functioning, you come to us. So we can do one comprehensive analysis, and also if we have to give you medicine for long term, we have to see whether it's better to change it over to something more suitable for your profile.
So doctor, can give your the contact address, and so that we can take a prior appointment and come and meet you. You are based at Chennai.
No.
So I am from NIMHANS only. So you can
Okay.
come to our geriatric OP. We are having screening OP daily, Monday to Saturday, except Sundays, Monday to Saturdays, including second Saturday, we are having screening OPD. So you feel free to come to us. Okay.
Thank you. Thank you.
Kindly visit, see, you can always visit NIMHANS on any day excepting Sunday, between say around 8:30 in the morning and 11:30. During that time, you can just visit there. I mean, have yourself registered as a patient, OP ticket. Then you can go get into geriatrics department for for evaluation. Once you are getting evaluated, then they will be able to treat you pakka. There should not be any problem, sir.
Thank you very much, sir. Thank you very much.
Good afternoon, madam. This is Dr. Mahesh speaking. So,
good afternoon.
So how do you treat dementia-related insomnia? Whether it is insomnia occurs in the early stage of dementia or late stage of dementia, and how do you treat in such situation when we have sometimes patient doesn't respond to all kinds of tranquilizers, sedatives, non-pharmacological therapies. So we usually in elderly after 70-75 years, we usually consider it as dementia related. Like after evaluation that patient has mild cognitive impairment. It can be due to dementia also. So as per your expert opinion, I would like to know which stage of dementia this sleep disorder starts and how to treat it.
So the first question is, I think, which stage? Okay, so it can happen as a prodromal as well as during the stage of dementia itself. Even in mild cognitive impairment, it can be there, and in dementia also it can be there. But probably maybe the reasons for dementia can vary during each of these times. Because so I think that's the prodromal, and during the dementia stage also it can be there, and even the transition period of mild cognitive impairment also it can be there. The second thing is that how do you treat it? So how do you treat it? The whatever resources or in our armamentarium, the what all medicines we have to treat a person with dementia and insomnia is the same as that for another elderly individual. The same thing applies. You have to titrate it according to the patient. So say, for example, Parkinsonism. Per patient is having Parkinsonism. So they may be having some sleep related RBD kind of disorders. So in that case, the benzodiazepine, which we consider addictive in other situations, may be beneficial for them. So in that way, so we have to, there is no specific medicine like targeting this particular dementia. There is nothing like that. And most often, sometimes it can be environmental. So there can be this, say, nighttime when there are shadows, they may be getting worried and anxious. They may not sleep due to that. Or it can be basically due to the disturbed sleep architecture in dementia. So we have to assess it in detail. As far as possible, manage it without medicines behaviorally, because as you know, I'm sure that you would have asked that question, because patient is having dementia, no medicine will be good for the compromised brain. So as far as possible, we do a detailed analysis why it is happening and try to manage it behaviorally. Otherwise, depending on the kind of dementia and the kind of insomnia that they are having, we can treat with benzodiazepines or even low dose quetiapine. All these options are available. So that's no single answer for that. It's patient tailored, basically.
Thank you, madam. Thank you.
Any other questions, sir? Madam, any other questions? Doctor, on behalf of the participants, I like to seek your opinion that normally we people go to this once in a year, once in 6 months, this advanced medical checkup, etc., etc. I mean, is there any checkup like that for this insomnia, sleep insomnia? And I mean, how do we determine that I'm having problem with regard to sleep disorder? So I may be having the problem, I may not recognize that at all. See, once you said that during the day, if you are able to be active, then whether you sleep in the night or not, don't bother. Can we take it that way? Or is it better that we guard ourselves, doctor?
Okay, so with that's a good question that you have asked. So, like, we are expecting basically, as I told, 5 to 7 hours of sleep, and it can vary between individuals. So the thing is that if you are having sleep within this range and then you are able to function adequately, it's fine. It's okay even if you don't consult any doctor. There is not a problem there for you to evaluate and address. So sleep disturbance is a subjective experience. So if there is that disturbance and distress, then only we need to manage it as a medical issue. And second thing, do we have any specific test for that, like to do with the health checkup? We don't have. So what is usually available is like this Apple Watch, actigraphy, all those things are there, which will basically look at your how much period you have spent in one phase of your sleep, how much period you have spent in the other phase of your sleep, how many times you are waking up. But it's better that you don't get preoccupied with this investigations and tests in case of sleep. It's not like the other sleep modalities. If you are perceiving a problem, you get yourself evaluated at that point. So that will be the better strategy. That's what I feel.
Thank you, doctor. But we also get nowadays lots of watches which say that we will these watches will monitor your sleeping pattern, how much sleep you are having, etc., etc. Are they really useful, doctor? Because it's very confusing.
Just going by the watch may not be good.
Yeah, that's what. See, because
many of your kids will be gifting you.
Yeah, see, these wearable devices, they say that no, don't worry about it. It will calculate your BP, it will calculate your heart rate, it will give you your SPO2 level, all those things, and it will also evaluate your sleeping, how deep you have slept, etc., etc. And are they reliable? I am not very sure about it, doctor. And incidentally, doctor, see, often we hear the word REMS, that is rapid eye movement. What exactly is this, doctor? And how can we perceive it as a person?
You cannot really perceive it like that because we have 3 stages of REM and then you have REM. So one is your, say, one part of that is where your deep sleep happens, and REM is the phase where activities are happening in your brain like you are awake, but your muscle tone is not there, so you are remaining sleepy. Okay, so when you have to, I mean, whatever is happening in your brain is not getting evident outside. You are dreaming, but you are not acting out your dream because your body is not having that thought. But it will be almost like you are awake during that period of sleep. So that is why it is called paradoxical sleep also. So the situation where you have to perceive that is not there. Okay, it's only when there are some sleep stages related difficulties that your doctor will ask you to specifically do test for assessing that. Otherwise, it's okay. Okay, so there is NREM, there will be that deep sleep happening. REM is that a fourth phase of your sleep where the brain remains active, but your body is in atonia and you are not acting out.
So that helps. Thank you. Yeah. Please go ahead, sir. Please go ahead.
Good evening, doctor.
Good evening.
The bed, how to maintain our bed for senior citizens? I think some people are having some foam and cotton or like that. Different kind of beds are any problem for good sleep or bad sleep, I think.
That will become so that will become a problem. Like sometimes the bed that we are using will be there for a long time and we don't really think about changing bed unless it becomes torn or there is some other issue. So that can affect your posture, that can lead to pain and that can interfere with your sleep. Otherwise, it will become a problem when you are having any like back related issue, any disc prolapse or anything of that sort. We usually prefer that the bed is not soft. It is little hard so that you can maintain that posture during the sleep. So it should be
from 95 onwards, I am have a walking practice by 5 o'clock morning. Without watching the time, usually I will get up. As you said, 6 or 7 hours sleep is good, I think. For the age 75 years, I am 75, completed. But in day activity, for the past 2 years, we are not able to go out and participate in function and other things, meetings like that. Now, within the town, we have to go out and come. That some restrictions are there. And most of our seniors are thinking that we have to look after our children, grandchildren, like that. They are thinking not about their body or health conditions. They are only worrying about their wards. That also bad habit or hindrance to sound sleep, I think. Most of our people are not talking with anybody, friends, companion, like that, outdoor meeting. That is one of the problem. And many people are not talking with the seniors also. Even home or neighbors or relatives, friends, they are secular like that. தனிமை அந்த மாதிரி இப்படி அந்த மாதிரியான ஒரு காரணத்துக்கும் தூக்கம் இல்லாம inadequate sleep, I think. What is your opinion?
Definitely, sir. There are in fact studies that have connected our social activity and our sleep. So it's important that you have a healthy social relationship. Otherwise, it can lead on to insomnia. So that is definitely true. Then now that you have put it into perspective, I would also like to tell that, like you told, there will be many stressful things that will be keeping you awake at night. So one commonly suggested strategy is that whether you are awake or whether you are asleep, that problems and those things will always be there. So sometimes we can train our brain in such a way that whatever is bothering you, write it on a piece of paper, keep it in your desk drawer, and tell to yourself that yes, this problem is there, but tomorrow morning when I get up or tomorrow I will think further about it. So even though it sounds silly, it is a very helpful strategy which can help people. So when there are too many worries that are coming to your mind, just write it on a piece of paper, keep it in your shelf or drawer, wherever, and tell to yourself that I will think about it tomorrow. Okay, so that will help in case of this minor worries that we have. And definitely, if you are having some issues like or psychological issues like adjustment disorder or anxiety or depression, and that is keeping you awake, we definitely will have to kind of address it or treat it so that your sleep becomes fine.
Good evening, doctor.
Thank you, doctor. Thank you, doctor.
Good evening. Good evening.
Hello.
Good evening.
Go ahead, sir. Go ahead, sir. Go ahead.
It was very interesting to listen. My simple clarification is this: what way our circadian rhythm is connected with sleep, or is it changes according to the age, or are we able to maintain this circadian rhythm even when we become old?
So circadian rhythm is definitely associated with sleep. As you know, the melatonin production and is definitely responsible for maintaining our sleep-wake rhythm or every other biological rhythm, as you put it for. So that's important. So, and that's why I told, because light is very important for melatonin production. So that is why sometimes even cataract can affect with that, or this excessive use of gadgets can affect that. So in that way, it is important. Then the second thing that you were asking was, how it affects, whether it gets affected with age. It does get affected, but we have usually seen that there will be an advanced phase shift where the elderly individual will tend to fall asleep earlier and get up earlier. That's some normal pattern that have been described with aging. So that is also due to the change in circadian rhythm. So yeah, that's it.
Okay, thank you, doctor.
Any other questions, sir? Madam? Madam, one very good takeaway from us, from most of us, is that your assertion that 5 to 7 hours sleep is adequate. See, most of us are able to sleep for 5 to 6 hours only. Therefore, we always get a doubt whether we are sleeping adequately. Especially when we become, say, more than 75, as Mr. Tangaraj sir was mentioning. See, when we are more than 75, we get a feeling whether am I sleeping right or wrong. See, these kinds of anxieties, whether what we are getting is right or wrong, is a big anxiety. That itself becomes anxiety, and that itself disturbs our sleep. Therefore, it's a good point, is that good takeaway for many of us is that, so if you are able to sleep for 5 to 7 hours, you feel comfortable. So
if insomnia is there, you don't have to look for it, you will know.
You will have to look, you don't have to look for it. And one more information, beautiful information, is that there is no blood test or something like that which can tell you whether you are having insomnia or not. You only have to feel it. If you are not able to do your job during the day, then there is a problem with you. That could, and one third important point is that let us not self-medicate. Let us not go to these pharmacies and take medicines. See, mostly it is happening that way, doctor. See, most of the people, they feel that coming to, institutions like NIMHANS, I have to wait for some time, I have to meet the doctor, they'll ask me to go for this test, that test, etc., etc. All these things will be adding. So then let me not go do all those things. Go to my
Sir, nowadays all district headquarters hospitals are having a psychiatrist.
Very good.
In all over India, particularly in Tamil Nadu, the system is there. We need not go to every time for NIMHANS. There is a private psychiatrist and government psychiatrist. First, they have to take kind of pre-consultation, And if they refer to NIMHANS, they can go for NIMHANS. This is my experience and suggestions.
You are perfectly correct, sir. That is the exact way to look at it. Because we are all in Bangalore, we always think of NIMHANS.
But rural people, many people are asking me, kindly tell to doctor like that. It is not necessary.
Not necessary.
Because initial stage, we can visit local doctors. They will evaluate and they will recommend if necessary.
Exactly, sir. Exactly. That is the best way. So people also need not be worried about meeting a psychiatrist. See, there is always some kind of, phobia attached with that. Why should I go to a psychiatrist? Psychiatrists are also doctors. We can also visit them. Like urologists, we can also go to psychologists as well. So that kind of, people may need to become a little more comfortable in meeting these psychiatrists.
One thing, confidentiality should be maintained when we approach a person. If any person wants to get your advice, Mr. Jambunathan sir, like that, as a senior person, is there any problem, sir? Like that, you have to maintain confidentiality that fellow has meet me and requested like that. This thing can be avoided. It is now people are still thinking it's a stigma.
That stigma should go away, sir.
Yes, but we have to. We have to counsel initially the people not worry. It is also a medicinal treatment. It is a consultation. You need not worry. Lots of people are taking treatment in home and in hospital like that. We have to convince them.
Exactly,
we have to convince them. Exactly. As a senior citizen, we are maintaining associations and clubs like that. We are interacting with many people. And we have to tell nothing to worry. From students, many students are during examination time, they are sometimes they are thinking bad things. And seniors also, middle age also, not irrespective of age, all are affected. It is not only for senior citizen. Thank you, doctor.
Exactly, sir. That's what that need not be any stigma about going to the doctor for that matter.
Sir, one more.
Hello.
Just to add a suggestion.
Please.
See, it is good that every district headquarters now there is a provision for a psychiatrist, and that is fine. But however, there should be understanding should be or awareness should be created about getting into a gerontologist. Okay, it is okay to contact a psychiatrist for a review and for assessment. That is fine. However, if you want a comprehensive, analysis and other things, it is my suggestion that we should try to approach an available gerontologist who is specialized, the elderly issues with the other psychosocial aspects and psychiatric aspects, even the biological aspects. So that kind of awareness should be generated. Okay, only if there is related to some kind of psychiatric issues. Okay, it is better. Even in that, a gerontologist would be a better suggestion to. But anyway, if you see the availability of the ratio of the doctor and the patient ratio, then rural, it is very difficult to establish any data. Okay, even in India, we don't have such data. Okay, even the NIMHANS report 2015-16 also not able to predict those data. We don't have. We have very generalized data. And another aspect, one is it is in the West it is growing, but in India we have to launch it. Otherwise the social gerontologist, people who are specialized in the gerontologic social work, but it's very rare in India. Maybe a few places, you can figure out it, you can number out it. So still we are in a phase that we have to work on that. At least in the cosmopolitan cities level, there is some kind of awareness about this. But in a district center, in a rural setup, it is very, pathetic conditions. So we have to work on to, generate the awareness at least about okay, there is a specialized person who is specially trained to handle the psychiatric issues of the elderly people. Such a person is called a geriatric. That has to come. But the first center which has started early in Chennai itself, I remember it is in Madras Medical College somewhere. And in Hyderabad, there is a one very big center it's like a big center is available. In the Tata Institute also offering such things. But still, we are very poor with, the gerontological background, psychiatrist, the specialization. This is my humble request and suggestion.
Hello.
Yeah, non-governmental organizations are related to these issues. They are taking some steps to spread the messages, availability of doctors, availability of hospitals, and things. These things in television, in radio, newspapers, like that. Messages should be spread to know the people. Even in a rural area, the developmental people or revenue department people, village administrative officer, village secretary, or gram sevaks, social welfare department, these people are going up to the lowest level to meet the people. They are having access. We have to tell them that these facilities are available in district headquarters hospital or private hospital. And lastly, NIMHANS is an all Indian institute where we can go and get our things settled like that. We have to do some propaganda in almost all. Now people are knowing about NIMHANS only, but district level things has to be, district administration has to take some steps to propaganda. Some notices like that. Thank you, Doctor. Thank you.
Thank you, Doctor. I think we are running out of time. Any other query, Doctor? See, in fact, this availability of this geriatric stents, that itself is that's in heavy short supply. Therefore, we'll. In fact, one of the roles of NIMHANS is that through these webinars and seminars, they are trying to reach out to all the people. Now, I mean, last week, I mean, somebody has requested that this kind of sleep hygiene about this can be conducted in Kannada also. In fact, I tell you, to be honest, we had a similar program in Kannada about 1 month back. There was a heavy demand that this should be conducted in English also. So, therefore, we have conducted it in English. Therefore, anyway, I think that it is already available in the YouTube. So, I mean, I will again request NIMHANS, pass on this request to NIMHANS people so that they can also, I mean, conduct one more session on this, because every day things are improving. Every day things are changing. What was yesterday, today is a new day. Tomorrow will be a altogether new day. Therefore, we'll continue with this, sir. Sir, any other person like to raise any other question? Because doctor's time is precious.
So thank you, Doctor and Mr. Jambanathan, for having presented a very nice work. Thank you.
Hello, good evening, Doctor.
Go ahead, please go ahead.
I'm one of the, hello, I'm Sindhu. I'm one of the volunteers of VMS. First of all, thank you very much, Doctor, for the very good session. Thank you very much. And I also thank VMS team, whole team. My question is, I have observed that some people, when they sit in front of TV and watch serial or something like that, they'll go to sleep immediately. But when they really go for sleep in the night, they'll not. They're not able to sleep at all. Why it is so?
That may not have any direct connection like that.
So daily, I have seen some people daily, only when they sit in front of TV, they'll get sleep. But when
there
they go
can be many reasons for that. Like what I told, one thing is that most common, I have already mentioned that elderly individuals tend to fall asleep earlier and wake up earlier. So sleep may be kicking in earlier for them. That is one possibility. So another thing is that like what we have to connect about serials and sleeping is that don't watch serials while you are on bed. That would be.
So is it because that they're forgetting all their worries and they're sitting in front of TV and they're watching, their attention is diverted? No, is it because of That
They can be relaxed and they may be sleeping. It's possible.
Madam, my another thing is, see, naturopathy and Ayurveda and all, there are some techniques, easy techniques. That is like a hot water foot bath. Before going to bed, they immerse both the legs in the hot water for 20-25 minutes so that they'll get good sleep. And some breathing exercise that also helps. That I have seen that. So I thought of sharing
Yes,
it here.
definitely. So any relaxation activities like deep breathing exercises or even muscle relaxation exercises that can relax you and help in sleeping. And regarding this hot water, this thing we usually suggest it in some particular disorders. Like if you remember, I had mentioned one thing like restless leg syndrome. So in those things, that has found to be beneficial. Like as far as our purview of treatment is concerned. So those things does help. You can try out.
Okay. Thank you very much, doctor. Thank you.
In fact, doctor, there is an alternative medicines department in NIMHANS itself. They are also talking about all these things. They are prescribing medicines like this, and they are also giving Ayurvedic medicines. Therefore, also it's holistic treatment. Whichever is going to give ultimate benefit to the patient, let us take that.
It should always be a comprehensive approach, holistic
approach. That's the comprehensive approach.
Thank you, sir. Thank you.
Okay. If there are no other questions, I can request the admin to and propose a vote of thanks.
Sir, thank you, sir. I am Kalavati.
Thank you, Kalavati. If you have got any question, please ask me.
Thank you, doctor. Very useful information we got. Thank you. Thank you. VMS.
Thank you. Thank you.
Now we can conclude. Thank you, Jambunathan sir, for your valuable contribution as a moderator in the session. Thank you. And I would like to thank you, Dr. Arathi, for enriching and informative session on sleep disorders. With that, I would like to thank all the Zoom and YouTube participants for joining with us today. And with that, I would like to thank all our partners, Government of Karnataka, Indian Psychiatric Society, Karnataka Chapter, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Happy 60+, Icon Life Sciences, REC Foundation, NSC Foundation, and Samadhana's Counseling Center. Once again, and thank you all, and have a good evening.
Have a good evening, ma. Thank you.
Thank you all.
Thank you. Thank you.
Thank you all.
One thing is that, doctor, we have already got beautiful, reviews in this. Everybody is happy about the way you have presented the thing. Therefore, we thank you. Thank you.
Thank you. Thank you. Bye.